name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirk again. And action. Hey everyone, it's Dr. Rick. And Donald had a question on what do we have to do in this next couple of days, weeks, and months regarding coronavirus. So if this is the first time you're finding me though, subscribe, hit the subscribe button down below, maybe the notification bell because you're probably going to be staying home watching videos, maybe mine, and wash your hands and social distancing and hunker down. But not to be an alarmist, however, I think that it's nice to hear that the president and the cabinet and the private sector is doing all these things to answer the call. I think if you look at China and then you look at what happened with Italy or Europe now, and you watch what happens with Britain, because they're the channel, that tube that connects Europe to England, the channel is a direct communication. England is separated by the continent of Europe with water. However, they are going to probably experience the same thing that happened in Italy, Europe soon. Just with a little bit of delay, and we will probably follow in suit. I think this is the behavior of the virus and the social structure in response. So the best thing is if you're the last one to be chosen in a kickball event, it's kind of cool because you could see which team is stronger, and you can also react to the other team by knowing their weaknesses. So if we watch what happened with and analyze what happened with China, with Italy, with Europe, and what's going to happen with Britain, I think that will be smart. Having drive-through testing centers will be cool. I think it's supposed to come into effect on Monday or Sunday. I have my reservations still. So at this point in time, I'm still getting influenza patients, supposedly flu patients coming in, and I have no idea what to do. Well, I know what to do, but I've been trained in mass casualty events, kind of like what the military preps for. Not to call it that, but I think if you know what to do in the terrible situation, you take it down a couple notches and you follow the protocol and you should be okay. But anybody that's going to be calling my office for flu-like symptoms at this point in time, stay home. If it's mild, meaning a little fever, a little cough, tickle in the throat, stay home. If it's worse than that, and it's putting the onus on you or patients, which is kind of spooky, but if it's worse than that, then you probably should be going to an immediate care center. I can't fit anybody to the office. I'm a chronic disease specialist or integrated medicine specialist. I see chronic disease, and sometimes, most of the time, most of the patients won't be infected. However, if you noticed Hopkins website, the blooms are continuing, but they're growing throughout the states. Hopkins website's pretty good, day-to-day updates, but this is what I would suggest. The mass casualty event. I trained with one group in Florida a while ago, and it's nice, protocol in case, because I was in sports medicine when I first started, and you have to know what to do in a football stadium or in a large event in case something happens. But the training is good. It gives you a sense of what to do. Just like I don't go to the ICU, I don't deliver babies, but I know how to do it from before, and at least I know somewhat of the protocol in case it ever happens. It's nice to know this stuff too. So in the case of a biological problem, which is what the virus is, there's a protocol of how to take care of things. But it's kind of nice if you look at what happens in mass casualty event. It's usually going to be you have to account for the critically ill, and that gets the most important thing. In a bomb scenario, you have to clear the way for the hospital system or the healthcare system to take care of the critically ill, usually surgical. You also have to have a preparedness for a surge, because everybody, the healthcare system will be overwhelmed all at once. If you've ever watched Pearl Harbor movies, you see everybody from Pearl Harbor, once that mass casualty event came in, went to overflowing ICU, and then at least in the movies, and then it spilled over into the hallways, spilled over into non-medical buildings, into the parking lots. That's what has to happen. And sometimes even in the hospital, when you don't have any staff available, you have to call in people who know a little bit and just give them a duty. Watch this person So one thing that we were told with mass casualty, if there was an explosion, you have to call out, you set up a center, and then you figure out who can help you immediately. You have to call out, anybody can hear my voice, come and walk this way. That'll at least get the walking wounded coming to you. The people that are healthy will come to you the quickest, and you can assign them to kind of triage the entire grounds. The people who are hobbling, you can figure out they're probably not going to die, but they'll probably be injured. So they're lower end triage. The people who can't come to you or can't move or have difficulty with moving, they need tending to. The people that aren't moving at all, they're probably gone. And unfortunately, with limited resources, taking care of those individuals would take you away from potential saves. So that's what usually happens in mass casualty. Now, in something as mild as coronavirus or a pandemic infection, you take it down a notch, but the template is about the same. So anybody that's seriously ill, coughing, can't breathe, fever, unresponsive, they have to go 911 to the emergency room and get evaluated and swabbed and tested and taken care of. Maybe they have pneumonia, or maybe they do have influenza. The folks that are at the opposite end, not having any symptoms, they can go about business, but they have to be cautious about washing hands, social distancing, maybe avoiding large crowds, which is social distancing, and being on the lookout for possible other folks that are sick. The people in the middle are the tough ones. So if you have a little bit of a fever, a little bit of a cough, a little bit of a sore throat, if you, in this scenario now, if I was to use a template and figure out things, I would say, let's get a test, but there's no test available. Now, maybe there will be on Monday or Sunday, but if I see that it's still difficult for me to get a test, anybody that calls up and says, I have a fever and sore throat and a tiny bit of a cough, I would just say, stay home. Now, it's hard because for a week, I think Britain's rules are pretty good. They say anybody with fever, cough, mild symptoms, stay home for 7 days. So they have self-isolation for 7 days. Now, the problem you run into is, what if a couple of those people have like a sinus infection from a bacteria, or a little bit of a bronchitis from bacteria, or they have asthma? You might miss them, but if it is true, they'll get worse, the theory is. And if they get worse, then they escalate to the next level, which is you have to go to the urgent care center emergency room. The problem with going to an urgent care center emergency, if you're not severe and you're not mild, but you're in the middle, you potentially, when you get triage there, might be exposed to somebody who has true coronavirus. So you have to be careful. The drive-through swabs in China, South Korea, and I think in Europe now, the drive-through swabs, you're supposed to change your personal, whoever's swabbing, I mean, the car pulls up, somebody with that full PPEs, that means mask, a shield, headgear, body, a condom essentially, has to go in with the window down, swab the nose, and then pull out, maybe swab the throat, depending on which test they do, and then put it, and then have them register, go in, and put it in the whatever it is that they transport it to the testing center for. And it takes, it's the true way you're supposed to do it. If I'm the one that's swabbing as you take off, I have to change everything, and it takes 20 minutes. I just can't see a drive-through. We'll see what happens, but you have to take everything off. Here in my office, I don't even have PPEs yet, so I just have a mask, N95. I've got gloves. That's about it. So way to do it, but I guess it's better than nothing. So if it comes around, cool. I'll probably be sending anybody with symptoms to the car line, and we'll see. Is it overcalling? Yes, it is, but we have a pandemic. So to make a decision as far as a healthcare worker, number one, I don't want to be sick because I'll bring it home to my family and I'll bring it to other patients, and I don't want to be sick. Number two, if I have no means to test, then to me, between mild and severe, everybody gets called. I have to do my part. Everybody gets called as a potential coronavirus carrier or patient. And if we treat the most severes and go to the hospital, it's going to overwhelm. It's going to have the surge. And it's going to overwhelm the health system. As I mentioned in the previous video, only have 32 beds in the ICU. I'm sure they're going to create and get ready for more. But the standard of care is off. For anybody that's coming in for checkup, getting blood tests, I would say wait till the next 3 to 4 weeks, because all I'm going to do is tell you about results, and we have other things going on. So do we say daily schedule as usual? I wouldn't. Again, I would wait. If we're just talking about deficiency and maybe lifestyle change, wait. I mean, we can do that later. We have to get through this thing together. So, and there's the surge, I think, will be in about 4 weeks, but that doesn't mean that it'll stop at that. We'll have to see what happens as every couple of weeks goes into the summer, end of summer and fall. But this will be around for a while. Hopefully the system will, what they call, flatten out the curve. Instead of having a peak where everybody has an infection, you bring the peak down and spread it out over the course of time. And it'll take care or help with the surge of everybody going to the hospital and going to the healthcare system. So to me, if I was to say that we had a visit scheduled, I would just postpone, really. Stay healthy, postpone, get outside to Forest Preserve, get some exercise, and I will be taking people on hikes with social distancing, because it's going to be very boring staying home. But stay home, shelter, water, food, and then communication. That's very important with regards to what to do during stay home isolation. That's what I would do. If you're really not exactly mild, not exactly severe, but you're curious, just call the office. I'll give you an order for a chest x-ray, order for a nasal swab for influenza, an order for a throat swab in case it's strep. If we do have the opportunity to get into the drive-through corona testing, if it comes about, cool, but we'll see. And I think, from what I understand, you have to fill out something online, and if you hit the bullet points, then you can go. But somewhere, I think they're going to tag that and say, call your primary care doctor first. But you know what? Everybody that I see is going to test. Just be careful. And hopefully you don't get it, but we'll make it through this. This is so important to stay healthy. This is so important to have stayed healthy. So all my warriors that made lifestyle changes, you will do fine. Whether you're 60, 70, or 80, you'll do fine. All my potential warriors who are about to change, do it now. Do it now, because this will last for at least till the end of the year. So if it surges again later on because of the morphing of the virus, at least we'll be prepared. But get your medicines taken care of, get your food changed, get your exercise at home, or I just bought gloves, but I'm always wiping things down at the gym, and start getting healthy now. Stop the alcohol, get some better sleep, watch my video for the herbals that I'd suggest for corona, and hopefully we'll all do great. So if you have any comments or worries, please don't panic, but put them down below. Otherwise, I'll see you at the next video.